Hi, my name is Maria Hudock, and I'm a seventh year MD PhD student at Columbia University in my fifth year in research. I was really excited to be awarded the PhRMA Foundation Predoctoral Drug Delivery Fellowship. I was very outdoorsy as a kid and very prone to climbing very high in trees and being warned by my mother, be careful, if you fall out, you'll break your spine and you'll never recover from that. And I was like wondering why this was the case. And couldn't a surgeon invent a new surgery to fix that? What if he just made a material to connect the nerves back together again? And from actually a pretty young age, I began to think that maybe I would be the surgeon who would invent a new material and learn to regenerate neurons in the spine. What I didn't realize until I went to college was that is not the role of a surgeon at all. Surgeons do marvelous things with their fingers, but it's not inventing new biomaterials. That is actually the role of an entirely different discipline, biomedical engineering, and also related fields. So I found that the dream that I'd had this entire time was not to be a surgeon, it was to be a biomedical engineer. With the support of the PhRMA Foundation, I'm trying to tackle the unsolved problem of cystic fibrosis gene therapy. Cystic fibrosis is a genetic disease, something you're born with, that affects multiple organs in the body, but mostly the lungs. It causes infections, scarring, sticky mucus buildup. People have been studying gene therapy for cystic fibrosis because it's a genetic disease with only a mutation in one single gene in our entire DNA. People have been working on this problem for more than 30 years, but without success. And part of that is because there's a big difference in the way that animal models, where we have to start with our preclinical testing, behave compared to human tissues and human organs inside our bodies. It's sort of like evaluating the best player for a basketball game in the animal model side, doing all of this testing to find the very best basketball player you can, and then taking them to the human side, where it's like they're being put onto a football field. Even the best basketball player in the world couldn't be expected to be wonderful at football. So what I'm studying is, what are the actual characteristics of this human football field? What do we need to be a good football player? In cystic fibrosis, we think it's two things. One, the ability to get inside human cells to deliver the genes, and two, the ability to get through that thick, sticky mucus layer. So we're trying to figure out how to measure those traits of the best football player on animal models, which look more like a basketball stadium, to be able to actually find the best therapeutics for humans. With the support of the foundation, I'm hoping this work can be a drop in the bucket towards advancing this gene therapy. Receiving the support of the PhRMA Foundation was enormously impactful for me and really meant a lot. This really was one of the first times that I got to test whether my ideas were something worth pursuing and write those down on paper and send them out into the world and have someone say, yes, I believe in this, give it a try. And that was just enormously validating and also wonderful practice for me to learn to be a better investigator and to think like a scientist as I'm in this trainee pathway. The things that I find the most fulfilling when the going gets hard, and the going is usually hard, I would say I would distill it down to awe and sharing awe. I don't think I've lost the sense that I had when I was a junior in college of looking through the microscope and just being like thrilled and surprised by this beauty of the natural world that I had the privilege of seeing. I think that one of my favorite things that still makes me almost giggle every time is working with lung tissues and seeing their cilia beating and doing their job and pushing little particles along. I'm so proud of them. It's like having little Neopets, if anyone remembers that generation of video games. And even greater is the joy when you get to share that awe with someone new. So I've had worked with a number of master's students, undergraduate students, medical students, people at all stages of training along the way, and I love the moment when I can show someone else through the microscope. I think conceptually they're interested, but then when they see too in front of them, look at those little cilia go. That is just such profound joy. And I think it's about enjoying the process of science and those little moments, those opportunities for awe, rather than the actual successes, because the successes are never guaranteed, and often they're few and far between. But the beauty of the wonder that we have the privilege of experiencing, that's what brings me fulfillment and keeps me going when times are tough. I'd like to apply tissue engineering and drug delivery strategies for cancer gene therapy, either as a practicing oncologist or neuro-oncologist, taking care of patients 1 day a week and working at the lab to solve these unsolved problems the rest of the week.